Acute heart failure constitutes one of the main cardiovascular emergencies worldwide and represents a major clinical challenge due to its high morbidity and mortality. Its management requires an exhaustive knowledge of pathophysiological classifications, triggering factors, and the clinical complexity that characterizes these patients. Understood as the rapid onset or worsening of symptoms such as dyspnea, edema, or hypoperfusion, heart failure demands immediate assessment, applying the principle of the sooner the better, since time is decisive for preserving myocardial function and preventing irreversible complications. From a diagnostic perspective, clinical criteria are combined with complementary tools such as echocardiography, lung ultrasound, and cardiac biomarkers, which make it possible to establish the severity of the condition and guide therapeutic decisions. Clinical classification into hemodynamic profiles: warm and dry, warm and wet, cold and dry, cold and wet, is essential to individualize interventions, while early identification of triggers through the Champi rule, acute coronary syndrome, hypertension, arrhythmias, mechanical causes, pulmonary embolism, and infections becomes a key tool in guiding the initial management strategy. Treatment requires a precise integration of pharmacological and non-pharmacological measures, ranging from diuretics and vasodilators to ventilatory support and mechanical assist devices in cases of cardiogenic shock. This advanced specialization not only allows for patient stabilization, but also optimizes prognosis in both the short and long term. Excellence in training in heart failure lies in consolidating competencies that unite the most up-to-date science with safe clinical practice, reaffirming professional leadership in the field of emergencies, urgent care, and critical care.